President Trump, in a speech at the Heritage Foundation in Washington on Tuesday, urged Congress to find a solution to the Obamacare mess instead of providing bailouts to insurance companies. Tom Brenner, The New York Times, Washington. Most people think of the term bailout as a political pejorative, often involving hundreds of billions of taxpayer dollars being funneled to failing companies. It's now become one of President Trump's oft-repeated rhetorical cudgels against the Affordable Care Act and federal payments to insurance companies. In April, the president accused Democrats of wanting to bail out insurance companies from disastrous Obamacare. In July, he threatened to end bailouts for insurance companies if Congress did not repeal and replace the Affordable Care Act. And in a speech Tuesday night to the conservative Heritage Foundation, Mr. Trump urged Congress to find a solution to the Obamacare mess instead of providing bailouts to insurance companies, but his use of the word is misleading. Bailout typically refers to financial assistance offered to prevent the bankruptcy of a company or industry. The 2008 Troubled Asset Relief Program, which Mr. Trump largely supported, was a bailout because it provided $700 billion for the Treasury Department to buy troubled securities from banks that were at risk of collapse. The funds Mr. Trump now refers to, on the other hand, are more accurately characterized as a reimbursement that the government pays to the insurance companies. It is done not to save the companies from financial ruin. Unlike the banks in 2008, they are not in danger of failing, but to cover the cost of cheaper health care for low and moderate-income Americans. Senator Patty Murray, Democrat of Washington, on Capitol Hill on Wednesday. Tom Brenner, The New York Times. Under the Affordable Care Act, insurers must offer plans with reduced out-of-pocket costs, like deductibles and co-payments, for people who have purchased a silver-level plan and who have incomes of 100 to 250% of the poverty level, about $24,600 to $61,500 for a family of four. About 7 million people, or about 58% of all Marketplace enrollees, qualified for that financial assistance this year. The government then compensates insurers for these cost-sharing reductions. The Congressional Budget Office estimated in January that the payments would amount to $10 billion this fiscal year and reach $135 billion over the next decade. The insurers don't make any money off of this, said Timothy S. Yost, an emeritus professor at the Washington and Lee University School of Law and a contributing editor at Health Affairs blog. They don't even cover administrative costs. It's simply a dollar in reimbursement. In 2014, the Republican-controlled House sued the Obama administration, arguing that the payments were unlawful as they were not appropriated by Congress, which is the branch of government that is authorized with spending public money. Last year, a federal judge sided with the House, but the Obama administration appealed. Mr. Trump opted to stop paying the insurers last week, citing the ruling. Insurers, legally obligated to offer the cost-sharing subsidies but with no way of funding them, responded by increasing premiums to offset the costs. Senator Lamar Alexander, Republican of Tennessee, and Senator Patty Murray, Democrat of Washington, announced on Tuesday they had reached a compromise bill to continue the subsidies funding for 2 years. A draft of the legislation indicates that the plan would appropriate the sums necessary for payments for cost-sharing reductions beginning in December 2017 and lasting through 2019. Mr. Trump, after initially appearing to approve the senator's efforts on Tuesday, modulated his support in a Twitter post on Wednesday that again invoked the specter of a bailout. I am supportive of Lamar as a person, also of the process, but I can never support bailing out INSCs who have made a fortune. Obamacare. Donald J. Trump at Real Donald Trump. October 18, 2017. Mr. Alexander concurred that CSRs should benefit consumers and not insurance companies, referring to the potential for insurers to double-dip by profiting from both cost-sharing reduction payments and higher premiums. The bill he is sponsoring with Ms. Murray seeks to prevent that, and gives states several options to address the issue, including rebates to consumers. Had the insurance firms actually double-dipped into both funding streams, the subsidies might have been more accurately been characterized as a bailout. But on their own, the cost-sharing reductions to insurance firms were not. Sarah Huckabee Sanders, the White House press secretary, signaled on Wednesday that the president opposes the compromise Senate bill as it is currently written, and again repeated the misleading notion of a bailout. "We've said all along that we want something that doesn't just bail out the insurance companies but actually provides relief for all Americans," she said. This bill doesn't address that fact. A version of this article appears in print on October 19, 2017, on page A17 of the New York edition with the headline "Payments for Insurers, Yes but Not Exactly Bailouts."